Hello, and welcome to this presentation. My name is Melissa McLaws, and I'm a veterinary epidemiologist working with the EU FMD. When animals and animal products move across country borders, such as they do with international trade, there's always the risk that they can carry diseases with them. In this presentation, I'll introduce the OIE risk assessment framework that can be used to characterize this risk. Risk analysis consists of 4 different components. There's hazard identification, in which the relevant pathogenic agents are identified. There's risk assessment, which assesses the risk associated with those relevant hazards. There's risk management, where the options to mitigate the risk are identified and evaluated. And all of this is underpinned by risk communication, which should happen between the authorities undertaking the assessment and the other stakeholders continuously throughout the process. There's 4 interrelated steps that make up risk assessment. There's entry assessment, followed by exposure assessment, consequence assessment, and all these are combined in a risk estimation step. We'll describe each one of these steps in this presentation. Let's take an example to go through the different components of risk assessment. Imagine that you're working for the veterinary services of country X, which is an FMD-free country, and you've been asked to perform a risk assessment for the following question. What is the risk of foot and mouth disease entering country X due to the importation of fresh beef from country Y? Let's use this diagram to illustrate the different components of risk assessment as they apply in our example. We start with the exporting country, Y, where the beef is moved from Y to the border of X. The entry assessment estimates the likelihood of the hazard foot and mouth disease being introduced with that commodity. Once past the border, the exposure assessment assesses the likelihood of susceptible animals coming into contact with foot and mouth disease. Finally, the consequence assessment evaluates what is likely to occur after that exposure in terms of establishment and spread within the population, as well as other consequences such as socioeconomic impact. Let's look at the different components of risk assessment in a little bit more detail, starting with the entry assessment. The entry assessment describes the biological pathways by which the hazard could be introduced into the importing country and estimates the likelihood of that entry. We can think of it in 4 steps. First of all, the entry pathways have to be defined and logical steps outlined. This is called a risk pathway. Secondly, relevant factors should be identified and data gathered. Using this data, the likelihood of each step can be considered, and the overall likelihood of the pathway can be estimated, and that can be done either qualitatively or quantitatively. Risk assessments can be qualitative or quantitative, and both are valid approaches. A qualitative risk assessment uses words to describe the risk. Words like high, medium, low, and negligible are used to describe the probabilities and consequences. And this differs from quantitative risk assessment, where numbers are used in the form of probability to describe the likelihood and consequences. When doing a risk assessment, you'll almost always start with a qualitative assessment. And this lays out the framework that can then be followed in a quantitative assessment if the data are available to support that. In both cases, they have to be done in a transparent fashion and should be fully documented. And as I said before, both are valid approaches. So let's go back to our example and look at a risk pathway for the entry of foot and mouth disease virus from the importation of meat. And we're going to go through the steps that are required for that FMD virus to enter the importing country. So it starts with FMD virus circulating in the exporting country. If it's not circulating, then the risk can be considered negligible. If it is circulating, however, Then we would consider whether or not the herd where the beef is sourced from is infected. Again, if it's not infected, there's no risk. But if it is, then an infected animal must be selected for slaughter. Again, if it's not, there's no risk. But if it is, then that an animal would go to the abattoir where it should undertake an inspection. And if foot-and-mouth disease remains undetected, then there's a probability that foot-and-mouth disease could enter the meat, where it must survive the chilling and maturation processes. And if it does that, then FMD can survive in the product and be imported into the country. Once the risk pathways have been defined, the next step is to identify factors that need to be considered and gather data about those factors. It's useful to think along 3 lines. Factors can be biological, like the expected prevalence of the pathogen in the country. There can be country factors, such as the capacity of the veterinary services. And there can be commodity factors, such as how long does the pathogen survive in the commodity. So as a simplified example, your entry assessment might look like this. You start with a description of the pathway and factors, saying that foot-and-mouth disease is endemic in country Y and beef cattle herds are infected every year. Clinical signs are often mild and may not be noticed during the ante or post-mortem slaughter inspections. Although the virus is inactivated by the drop in pH associated with the maturation of meat, it is possible that some virus can survive chilling and maturation for several days. And then you estimate the likelihood. If fresh meat is imported to country X from country Y, there's a low likelihood of it being contaminated with viable foot-and-mouth disease virus. And a low likelihood means that the occurrence of the event is a possibility in some situations. If the likelihood of entry is determined to be negligible, then you can stop at this point. Your risk assessment may be concluded. However, if it's greater than negligible, then you continue on to do the exposure assessment. The exposure assessment describes the biological pathways through which animals in the environment would be exposed, but not necessarily infected, to the hazard and the likelihood for each one of those pathways. So it's similar to the entry assessment. You define the risk pathways, identify relevant factors to consider the likelihood of each step along the pathway, and finally estimate the likelihood of the overall pathway. So continuing with our example, here's a scenario tree for the exposure assessment. And you can see that it begins with foot-and-mouth disease, contaminated meat already imported. And then it goes on to describe 2 possible pathways. One in which pigs are fed contaminated swill, resulting in susceptible animals being exposed. And the second one in which wild animals are exposed because the contaminated meat has been disposed of in a landfill. And there may be other pathways that could exist as well. Again, factors to consider need to be identified. And again, these can be biological factors, country factors, or commodity factors. And so your completed exposure assessment could look something like this. Most fresh meat imported for commercial use is sold at a supermarket or restaurant. The virus is readily inactivated by cooking. It is illegal to feed swill to pigs. However, some backyard producers may not comply with these regulations. Uncooked meat with viable virus may be disposed of in landfills, which are frequented by wild pigs. And then estimated the likelihood. If fresh meat contaminated with foot-and-mouth disease virus enters country X, there's a very low likelihood of a susceptible animal being exposed. And wherever possible, this should be backed up with data. If you can have information, more detailed information about the inactivation of the virus, about how frequently backyard producers, have been found to not comply. All this would be relevant data to include within your assessment. This is just a simplified example. And again, if the likelihood of exposure is determined to be negligible, then the risk assessment can be concluded. However, if not, then you move on to the consequence assessment. The consequence assessment describes the impact of the unwanted event should it occur, and it can consider both socioeconomic and epidemiological criteria. If human health is involved, there could also be public health considerations included. So this is often one of the more challenging things of a risk assessment, and a useful approach can be to identify a couple of potential outbreak scenarios. For example, infection might be contained to a few farms within a small area, as opposed to having a widespread large outbreak. And then the likelihood and magnitude of the consequences for each of the different scenarios should be estimated. So for example, if a susceptible animal was exposed to foot-and-mouth disease virus in country X, there's a very high likelihood that the susceptible animal would become infected because a very low infectious dose is required. Possible scenarios that could ensue are, number one, the infection spreads within the local wild animal population and eventually dies out. Secondly, there could be spread to the domestic livestock population. However, the incursion is detected quickly, resulting in a small outbreak, and the country can recover freedom within 6 months. Finally, there might be spread to the domestic livestock population, in which there's a large outbreak, and it takes more than a year for the country to be recognized as free. After the different scenarios have been identified, the likelihood of each scenario and the magnitude of its consequences can be summarized in a table like this one. So let's go through what would happen if the outbreak was limited to the wild population. First of all, the likelihood of this occurring was assessed as moderate, and it would depend on the location of the outbreak, probably how close domestic livestock are to the wild population. And then in terms of the magnitude of consequences, we think about animal health consequences, economic consequences, and social consequences. The animal health consequences were assessed as low because it would be limited to wild boar, who are mostly expected to recover. The country would suffer from high economic consequences, however, due to the loss of important export markets. And there's also social consequences expected, assessed to be moderate, but depending on what control measures are chosen to control the outbreak. And then a similar type analysis would be done in the event of a small outbreak or a large outbreak. Following the consequence assessment, the next step is to put everything together into the risk estimation. And this just summarizes the likelihood of entry, of exposure, and describes the consequences so that the reader has all of these assessments together in one place. And that concludes my presentation on risk assessment. I hope that you found it useful, and I look forward to seeing you in other presentations. Thank you.